Humans have always depended on animals for centuries all over the world, whether it be for food, to ease a workload, or for new discoveries, or just to have around for companionship. It is quite common, especially in first world countries, to have at least one animal living in or at a household that is considered to be a pet or a member of the family. Depending on where you are across the world or even across the country, the type of animal ownership may be different, but one thing that remains the same is the relationship between humans and animals. This relationship is referred to the human and animal bond. According to the American Veterinary Medical Association, this bond can be defined as a mutually beneficial and dynamic relationship between people and animals that is influenced by behaviors that are essential for health and well-being of both. Not only can animals help us in physical ways, but they can also help us to improve our life psychologically as well. Animals are gaining a more important role in the mental health field as they are showing to help improve the lives of people who suffer with mental illnesses. Anxiety and depression are two personality disorders that are comorbid with many other different disorders and can be developed because of many different reasons. Therefore, these two disorders are a great example of how animals can help different people overcome mental health obstacles. Animal-assisted therapy is a major way that animals can help individuals who suffer with mental illnesses. These animals are specifically trained in order to help patients with different disabilities. They can be used in a variety of settings, such as group setting that is used just to primarily elevate moods, or in individual settings in order to help achieve patients' goals for therapy. Animal-assisted therapy has been around for centuries. The first recorded data of animal-assisted therapy took place in England in 1792. Animals were brought in with the treatment of patients with mental illnesses in a small infirmary in order to help for the nurses to reduce the amount of medicine and restraints needed to be used with the mental health patients that they cared for. The idea of animal therapy began to spread as a more popular type of treatment in the mental health field across the world in the 19th century. The treatment idea has flourished even more throughout the years as researchers are finding this treatment to be showing itself as a legitimate way to aid in the area of the mental health field. Animal-assisted therapy can be used in many different cases in order to treat depression and anxiety. Presenting someone with mild responsibility and control of a situation that they are comfortable with can play a key role in the treatment of anxiety and depression. This is because the patient is given a feeling of importance and the ability to govern over an outcome that they desire. Studies have shown that animals can help depression and anxiety in a very simple way of just needing to be cared for. When patients are given the responsibility of taking care of an animal, it can give them a sense of meaning. They do not feel worthless or lonely, which are two very common aspects of depression, because they have an animal relying on them to perform basic needs. The patients are able to relax while interacting with the animals because they feel less fear of being judged and instead feel needed and accomplished. Animal interaction can be especially helpful in nursing homes where residents may not express much interest or may not be able to interact with other residents easily for whatever reason. These animals can create a sense of companionship for the residents. Companionship is a very important element that people need in their lives in order to build a healthy sense of self-worth. When people feel as if they do not have anyone or very few people that they are loved by, it can lead to feeling down, or maybe down, sad, or maybe eventually leading to depression. Being that many residents in nursing homes have lost spouses, family members, and friends, they are at very high risk of developing these feelings of depression. Therapy dogs can give the residents a sense of companionship and can even cause a mutual topic for residents to discuss, creating an opportunity for social bonds to grow. Sometimes these animals can even be used as a distraction or a relaxer for those who suffer from anxiety and depression due to physical problems. People who suffer from chronic pain because of a disease or are sick in another manner may benefit from the distraction of an animal. It is easier to ignore something negative if you are presented with something positive to focus your mind on. This concept is prove when the positive aspect is something that you actually have to interact with. The results of a study with animals acting with fibromyalgia patients while in a waiting room reported that pain severity was significantly reduced after a brief session with a therapy dog. In contrast, the individuals in the study that were not introduced to this therapy dog did not have any decline in pain. This shows that therapy dogs can be used to reduce pain by occupying a patient as a positive stimulant and elevating the overall mood. This mood elevating can help to release endorphins, which naturally reduce pain. Another constructive aspect to the distraction given to the patients in the waiting room is the reduction of stress and anxiety. Being able to keep their mind off the appointment that is ahead of them can lower the patient's blood pressure and to calm them down. This can allow the appointment to go smoother because the patient is less anxious and in better spirits. An argument that will always arrive with the topic of animal-assisted therapy is going to be whether or not it is more effective than medication in treating anxiety and depression. A factor that is the downfall of medication is the time duration that it takes to start working. Most depression and anxiety medications take a few weeks to start showing improvement in patients. This time gap can often lead to patients ceasing to take their medication because they are not feeling any benefits from it. With animal-assisted therapy, the feelings of depression and anxiety can decrease almost immediately with contact with the animal, helping and encouraging the patients to continue with animal-assisted therapy treatments in order to revive the good feelings. On the other side of the argument, there are factors that glorify medications as well. Medications can be more convenient for patients because it can be taken with you anywhere to keep your mood steady, whereas you cannot always have an animal around if needed. Another reason medications can be favored is because there is more research that is done on medications effectively treating depression than animal-assisted therapy alone. In reality, there is no definite answer as to which method is 100% right or any psychological method for that matter. This is because all patients are different and react to therapy differently. One thing that has appeared as a recurring fact throughout mental health therapy research is that one way or another, animal-assisted therapy does in fact increase positive moods in patients that experience anxiety and depression. Using animals in therapy as a part of treatment for these personality disorders is a very effective way to help increase a person's overall quality of life. Without animals living alongside us in the world, we would face many difficult survival means to overcome, and this includes survival based on mental health.